We have Twila Brase with us. Twila Brase, of course, you know from CCH Freedom, Citizens for CCH Freedom is Citizen Council for Health Freedom. You know Twila, she is here on the third Thursday of every month with us, and Twila, I believe, one of the great experts on the impact and the effects on us as individuals as it pertains to Obamacare. And if you don't get her newsletter, you are going to fall into the uninformed realm, and I don't want that to happen. Please go to cchfreedom.org, and just subscribe to her Health Freedom e-news. Very, very important that we stay informed on all these issues. And I think we're going to start seeing more and more of these issues come out fast and furious over the next several months. Twila, welcome.
Thank you, Dan. Glad to be here.
Twila, so tell me about, we are trying, I guess there are some states, some areas trying to desensitize Americans to the tax, and we're calling this, it is not really, they're not calling it a tax now, it's a fee. And right. I guess we're okay with fees and we're not okay with tax, but most Americans know the fee is a tax, like most fees are. Tell us about that.
Well, my guess is this is all part of, if you might recall, Jonathan Gruber is in the news, yes. One of the architects of Obamacare, and all the things that he has said about the stupidity of Americans. Mm-hmm. One thing that he said was that they crafted the law in a tortured way in order to make sure that the Congressional Budget Office could not score the mandate as a tax, because then it would have died. And so clearly, they, despite all of Mr. Gruber's statements otherwise, the American people are smart, and they know the American people are smart. And if you tell them it's a tax, they're not going to like it. And so they continue this deceptive way in Obamacare to try to sell the American people on the law and on the Obamacare program itself as coverage. And so one of the things that they're doing, if you go to healthcare.gov, sprinkled throughout that site, if you look at anything about the fees and the mandate, and or I think they might call it fees and requirement or fees and whatever. They call it fees. So the word fee has been replaced all throughout the site, and they talk about the fee. And in one spot they say sometimes it's been called mandate or individual or personal responsibility payment or whatever. But the fact of the matter is that the U.S. Supreme Court called it a tax and therefore allowed it to go forward. And clearly, if Jonathan Gruber said, we tried in a tortured way to make sure it couldn't be looked at as a tax, they knew that that's exactly how it could be looked at, and they wanted to make sure that the American people didn't see it. So this is just another way that they're trying to soften the impact and not let people know that this is truly a tax on them. And the mandate to purchase health insurance is the largest tax ever on the American public. So there's two taxes. One, the mandate to purchase, and two, if you don't purchase, you have to pay this penalty tax for refusing to purchase.
So tell us about the penalty tax, because it's a little different this year than it was last year, isn't it?
Right. This year it is $325 or up to 2% of your income. And someone just yesterday told me something that I really hadn't thought about, and it will probably ring really quickly with you and your listeners, is that actually the $325 could be significantly higher for someone of low income than 2%. So for somebody of high income, that 2% could yield obviously 2%, but the $325 could end up to be perhaps 6% of someone in lower income.
Right.
So that's an interesting little piece of it. And so, but the other thing you need to understand is it's not necessarily either of those two. It depends on how long you are uninsured during the year. So if you are uninsured for the full 12 months, that's true. If you are uninsured or uncovered for 6 months, it's only half that because it is a prorated amount.
Okay. Well, so the fee compared to last year, the taxes are going to be much, much higher. Have they changed the tax credit? I hate even thinking about it.
The premiums, subsidies.
Yes.
They have not changed that. They've not changed it, but what people will find if they have Obamacare, which we call Medicaid for the middle class on a sliding fee scale, if they have Obamacare and they have a subsidy, the administration plans to automatically enroll them, auto-enroll, on December 15th unless they have gone onto the website and changed their own coverage or unless they have quit paying for coverage. And if that happens, then people might be surprised because the base level, the base plan on which all the subsidies are based is going to change. So that's changing. So if you don't go on and change your plan, you might find yourself with a higher payment and a lower subsidy. But, of course, our whole emphasis is to get people to refuse to enroll, so we would prefer you don't re-enroll and you actually stop payment and thereby starve this beast of being able to embed itself into the country.
Well, my wife and I are moving to Samaritan's Ministries January 1st, and, I had an opportunity to visit with Samaritan's Ministries, the health sharing program, out in Peoria, Illinois, and you talked a little bit about their growth and what has happened as a result of this, and it is amazing. So there are an awful lot of people that are refusing to enroll, and we have all got to get together and just refuse and let this thing fall under its own weight. But we've got to refuse to enroll, and the other reason is for privacy concerns. I mean, is another great reason not to give the federal government our information.
Right. One of the things that we say is he who holds the data makes the rules. Mm-hmm. So when you give the government information in one spot on your family status, on your income status, on your entire household of income, your tax status, there's some medical status in there. Your numbers, like your Social Security number, your citizenship, all of this into one brand new federal database that experts have already said is completely insecure against hackers. And already the exchange has been hacked into once. And so, there's no security there. He who holds the data makes the rules. That means you hand over all this information for profiling other purposes by the government and for IRS enforcement. And so there's all sorts of reasons to refuse to enroll. And, one thing interesting about Samaritan Ministries, which you may or may not know, is that in the last 2 months, the shares that members have paid have been reduced. So the amount that members have paid the last 2 months has been lower than the share that everyone is supposed to pay because they had so much money that they could cut down the shares temporarily. And I don't think you'll see that with the health insurance company.
I don't think you're going to see that with the health insurance. So let me ask you a question that people seem to ask me a lot. And I usually refer them to cchfreedom.org. But so this year coming up, do you expect or do you see or are you watchdogging any of the coverages that are being cut? And I'm talking about prescription services that are likely to be cut, maybe actual services in things like cancer clinics and those kinds of things. Are we going to see more of that going into next year?
Well, there are a number of things at play there. One is the narrow networks for coverage within Obamacare. But the other is the ObamaCare accountable care organizations, where hospitals essentially gobble up clinics and they become this entity that the federal government pays one capitated fee, and then the hospital, which gets that money, divvies it out to the doctors and has only a certain amount of money to pay for the care of all the patients within this bundle. And so I think then the federal government has cut something that's called disproportionate share payments. What they really are is charity payments to the hospitals. That's something that Obamacare did as well. And I have read reports of hospitals discontinue. They would take that money before and they would have special clinics or special this or special that, and that's now being cut so that they don't have, they're cutting those kind of services. The other thing that I read recently, which I thought was kind of bemusing, I think would be the word, is they were talking yesterday or the day before in this article about the physician shortage. And there is indeed a physician shortage. But the folks who were part of this article were saying, no worries, no worries. We will just have other folks like physician assistants and nurses and nurse practitioners. And, those are wonderful people. I'm a registered nurse myself.
Yes.
But I know the distinction between those and a physician. And I don't think that the American people would be actually very happy about the fact that those who are in control think it's perfectly fine to limit all of our access to physicians and only give us physicians whenever they think we need a physician or whenever something gets out of control and someone finally lets us go to a physician.
Yeah.
So I think those kind of things are going to be coming more and more, and people who are used to having access to this are going to be more upset about where Obamacare is taking us.
So let me go back for where you were talking about the hospitals, gobbling up these clinics, forming these to get more money from the government. Are they yet, or I gotta believe, just from an economic perspective, they're going to have to turn people away at a certain point, right? Because they don't want to eat up all the money that they've received. Has that happened yet?
They're kind of a little bit in a predicament because we still have this one law that says anybody who comes to the emergency room still has to be taken care of.
Yes.
So they have that. And the Accountable Care Organization, the ACO, set up with hospitals and doctors groups. Some doctors groups are setting up their own ACO without a hospital, but a lot of them are hospital and doctors groups. Okay. They become responsible for a population. So this is one of the reasons why hospitals are now starting to contract with data aggregators who will look at the population around their community and try and figure out who is going to be expensive. Who should we go contact before they ever come into our doors and help them to live a more healthy life? This is the intrusion of Obamacare. This is the setup that Obamacare has that is going to be very intrusive on the American people because it is set up to make these doctors and hospitals responsible under a capitated amount. So a limited amount of money is given to them and say, for your entire population, this is all you get. So they're going to start limiting access to professionals. They're going to start waiting before you can get certain access to care. It'll be better to get to have a need in the beginning of the year rather than the end of the year because there's more money at the beginning and more rationing at the end. All of those things are possible under this capitation setup that Obamacare is moving the healthcare system toward.
Well, the nightmare continues, folks, and it continues to get worse. And if you're not informed, you better get informed. You better stay in touch with cchfreedom.org. That website and Twila herself is an incredible resource to all of us. And if you want to get not only Twila's biblical worldview on all of this, but also just to be informed, to understand what is happening, to have an email that you're getting every single week that is giving you the current and the latest information on how this Obamacare nightmare continues to develop. and it's cchfreedom.org. Twila, I'm almost out of time, but I got to ask you this real quick. In your opinion, do you think that this new Congress is going to have any positive impact on this piece of legislation?
Well, I think that there's a possibility, but I'm wondering because Kevin McCarthy, who's Majority Leader of the House, hemmed and hawed when Megyn Kelly on Fox News asked him if he was going to bring a repeal. And he finally said, I won't bring a repeal until I have the ability to replace it at the same time. Well, that could be forever.
Right, exactly.
And so I think that's a problem.
Yeah. I think it's a problem, too, and I was wondering what your insight was on that. Twila, we appreciate you so much, and I know you're busy, and to take some time to come on with us here each month, and twice this month, I believe, right? Or maybe it was at the end of last month that you came in when some of this news was breaking. But we sure appreciate it. cchfreedom.org. Folks, please go today, even if right now, during this break, click on cchfreedom.org. Click right at the top, front page. Subscribe to the Health Freedom e-news. You need to get that. It's free, right, Twila?
It is. It's free. And, I know you're almost out of time, but I just want to say during the lame duck session,
yes,
if you don't mind me saying this, they're going to try to vote on a bill that we are trying to get parent consent for the storage and use of baby DNA.
Yeah, saw that.
They're going to try in December, and we would hope that people would come to our website and learn what they can do to tell their members to add parent consent to the newborn screening bill.
And we need to do that today, folks.
Today.
cchfreedom.org. cchfreedom.org. Thank you, Twila, as always. We sure appreciate it.